I'm just going to quickly introduce Dr. Anil. So, Dr. Anil is basically today's topic is going to be discussing botched cosmetic surgeries abroad and the disaster costs for the NHS. And it's one of the UK's and Dr. Anil is one of the UK leading plastic surgeons. So, Dr. Anil, good morning. How are you? Is Dr. Anil
Morning.
Joshi or Yoshi?
Joshi, Joshi. Yeah,
Perfect.
it's with
Thank
J.
you. Good. I didn't want to butcher it, so I just thought I'd double check. Thank you so much for joining us, by the way. I really appreciate that. So, first of all, we're just going to jump straight into this because this is a huge topic, and it's really interesting because I've actually recently seen something online which was pretty gruesome and terrifying. So, actually, the fact that we're talking about this today is really interesting and relevant. So, we're hearing more and more about cosmetic surgeries and the disasters abroad. Now, what's really going on? Like, why is it such a growing problem?
Yeah, couple of things. I wouldn't use the word botched surgery straight away to every single thing
Okay.
because it's not to blame something there, but I would still say complications born from some of the surgeries done elsewhere or some of the unexpected outcomes or procedures done without adequate follow-ups. So a lot of people who travel outside for such surgeries, and if I'm very honest, they're not reckless. They've done their research, but sometimes I feel they are quite vulnerable and they're quite price sensitive and largely misinformed. And a few points towards why this would be the case. One is, there's a lot of globalization of plastic surgery today. The world has gone smaller. And on top of that, because of such a narrow world, there's aggressive social media marketing. Some of it would be quite unjustifiable. And there is a lot of, let's say, influencer-driven expectations.
Yeah, so true.
And sometimes you see there are these all-inclusive surgical packages, like as if these are holidays.
Yeah.
It doesn't work that way. And then lastly, with some of these, there's a very limited understanding of surgical risks, the anatomy of the body, or more importantly, the long-term outcomes.
Yeah.
So one thing which I have to say in just a bullet point, all of these together is surgery is not a commodity. You cannot buy it or compare it as if you're buying a phone or booking a hotel or things like that. So one has got to be understanding all of these points before jumping in.
Yeah. No, and I get that because it's like I feel. I mean, I've been offered countless amounts of hair transplants and teeth and this and that, and I'm always like, no, like I don't need it. And actually, I would rather make sure money's coming back into the UK, and also I would kind of rather, if I needed a checkup, be able to go and get my checkup and not have to fly, let's say Turkey, because that's probably one of the most common places. Fly 4 or 5 hours just for a checkup and lose a whole week or lose half a week. Now, you mentioned something which was really interesting. You mentioned about obviously like these holiday packages. I'm assuming it's like medical tourism, right? It's it sounds harmless or even potentially quite glamorous, really. But from your perspective as a surgeon, what is the reality with this? Like, people are buying packages and then they're kind of getting all these things for free, or what's your understanding and knowledge of it?
Sometimes because I get patients who have not been looked after well, or surgeries gone wrong elsewhere, or even complications, which I'm happy to talk about some of these, because that's also going to add a lot of strain on my both NHS as well as private practice. NHS more importantly because it's the taxpayers' money.
Yeah.
So some of these packages are quite interesting, where they even send a chauffeur-driven car in London or wherever in UK to pick up the patient, take them to the airport, and from the airport they are taken in another car to the hotel, and then to see the doctor. They may have not seen them before, maybe just once on Zoom, and I don't know how they're going to diagnose just seeing once on Zoom. But then they're straight into theaters, surgery, of same journey back. So, and then all of these in a cut price which you can't even think of.
Yeah.
So when someone is going for such price sensitive thing, if it is too good, it's too good to be true.
Yeah, so true. So you also agree that you think people are going purely because of the price, and they think they're going to save a few hundred or £1,000, really.
Yeah. I mean, one of them, of course, the large chunk would be towards the price, but the other aspect, as I mentioned earlier, would be aggressive marketing
Yes,
or
yeah, it's
social
true.
media, where you do not know what is right, what is wrong. You are only seeing what is sure thrown on your face is the reality. Unfortunately, that's the way the world is working today.
Yeah, and again, it's powered by social media, and I speak about social media quite a lot on this show and how
Hmm.
it's got such a negative impact. I feel like social media has helped the younger generation leave clubbing and going out as much and improve that kind of like health and fitness.
Yeah.
But it's also got such a negative effect because, like you said, you get influencers and social media people, people that go on TV, people that you feel like you like, know, and trust. And you're like, oh my god, their teeth look amazing. I'm gonna get them done. That's giving me the reason, and I get a holiday. They think they're getting a free holiday, but they're actually potentially getting the complete opposite. Now, a new study suggests cosmetic surgeries abroad can cost the NHS up to £20,000 per patient. Were you surprised by those figures?
If I'm honest, I'm not, because I can
Okay.
talk from my experience itself,
Yeah.
which is why I'll be very confident to talk about it because I see these day in and day out.
I bet. I bet.
There are medically risen necessary complications such as infections,
Hmm.
tissue necrosis, breathing issues following a nose job or a rhinoplasty, injuries to nerves like facial nerve, or large extensive scarring.
Mm.
And some of these may require emergency care,
Yeah.
multiple outpatient visits, and some of the complex revision or reconstructive surgeries.
Yeah.
And then more importantly, on along that would be long-term psychological support as well. So when you see all of these, the way I say is when complications arise, NHS is there as a safety net, but we've got to understand is this safety net is already being super stretched.
Well, yeah, isn't it just, it's like the
Yeah,
NHS has enough to deal with as it is, let
yeah,
alone someone's, and I'm not going to mix my words here, stupidity
yeah,
when it comes to making a decision. Like, and people are making decisions within a week.
yeah,
How quickly do you think? I'm sure there's a percentage or there's a number out there where
yeah,
people are impulse buyers, right? And they go, I've been thinking about it for a day. I'm just going to do it. And they do it. And then it's too late. When it's done, it's
yeah.
done.
You can't
Um,
change it.
no,
It's irreversible.
exactly. Now, obviously, I always go back onto tattoos. I don't have any. I think they're great. I think they look really good on some people. But then there's a reason why laser surgery has come into play because
Yeah,
people make mistakes. But it's like with other things, like,
yeah,
when you go and get, you said tissue necrosis, which is obviously dying of the tissues or death, the
yeah.
tissues or the cells attacking each other.
Yeah, I can give you one quick example
Please do.
if
Well, I
you
was
if
going to
you're
go
okay
on to
with
it in a minute, actually. And the next question was going to be about
yeah.
complications and stuff. So I'll let you continue.
I'll just tie it both together.
Yeah, please do.
Like there's one really young, like mid-20s girl. She's a very young, beautiful girl who saved some of her money because that would be still one third of what would have been
Yeah.
a cosmetic surgery for a nose job
Yeah.
in UK. Anyways, she goes to another country, which I wouldn't name names,
Yeah.
but it's somewhere outside. Gets the surgery done because she's got East Asian heritage.
Yeah.
She wanted to build the nose like a Caucasian.
Hmm.
And there they fill up the tissue to augment with a foreign material called PTFE, one of these things, like silicone or
Yeah.
PTFE. And anyways, she comes back to UK in London. She just sees a tiny bit of discoloration on the tip of her nose.
Hmm.
She doesn't think much of it. And a week later, she's rushed into my NHS hospital with pus pouring out of that area. And then I got involved, and she was basically admitted initially for 3 days of high IV antibiotics,
Yeah.
then took her to theaters, opened up the area, cleared all the pus out,
Whoa.
and I had to remove that implant. Unfortunately, the way these kind of implants work is the tissues start to grow around them, which means and also integrate with them. So just to pull them out is not easy.
No, I bet.
You've got to really, stretch yourself to get this out. And long story short, post that, she again had a few more days of antibiotics, went home, and now her nose is completely disfigured and scarred. And she's come and seen me in my clinic, and it's collapsed, breathing problems. And now I got to reconstruct that with a piece of rib. And that's going to take 4 hours of my work, complex work, stretching NHS like crazy.
Yeah.
And you can just do your own math on all of these. And your 20K sounds like a large discount.
Yeah, I bet. And it's it's crazy. I literally got sent something the other day, which is basically what I was talking about at the start. My friend sent me something, and it was some girl that went abroad. I don't know where she went. I think I know where she went, but again, I'm not going to mention where because I don't know. And she had this, like, her left nasal passage was like up by her eyes, and it was just pure black. And she'd had her teeth done, and I'm not squeamish. I've worked in the medical section before. I've seen lots of blood. You know, I've extricated players off pitches with broken limbs. You know, you name it. Avulsion fractures. Nothing bugs me or scares me. But that really kind of didn't turn my stomach. But I just thought, everyone probably thinks it's not going to be me. It's not going to be me. But when it's you, it, like we said, it's just too late. And it's actually... Well, I feel really bad for the example you were just explaining, where, you know, her nasal passage is collapsed, and she needs so much more than just, you know, surgery. She probably going to need a lot more than that long term, right? Isn't it?
It's a multiple stage one, and with a piece of rib from the chest, a cartilage from there to reconstruct. There's nothing left there.
Yeah, no, I get that. So, would you say that there are other kinds of complications that are commonly seen? You know, obviously you deal with lots of patients. Is there a particular complication that you see lots of? Would it be maybe more teeth, more nose, more hair transplants? I don't know.
So for me, being a facial plastic surgeon, it's in this area of work. Be it rhinoplasties, facelifts. I've had another woman, a very nice lady, really nice lady. She was in her early 30s, but she came for something for her nose. But then I started having a quick cast on her face, and I said, "What's wrong with your face? Is that okay? You can tell me openly."
Yeah.
So she's going to one of the usual suspect countries for a nose job, and so this was for a revision that she'd come back to me, so that had failed. And when I asked her, and so this was 5 years ago, which meant she would have been 26, 27, right? And she was at that age offered facelift as an addition to the nose job. And with that, unfortunately, there was such huge scar all around her around her ears in front, turning around into the back of the head. And that looks really very obvious and on both sides. And it's really hard. You know, we get these examples very often. So it's so heart-wrenching to talk about that.
Yeah, I bet. And obviously you experience it firsthand, and I'm sure you see some pretty emotional people, really, and people wishing they probably hadn't made the choice and made the mistake. Now, that's going to actually lead me on to what I want to ask you next. Like, procedures like Brazilian butt lifts and tummy tucks are often marketed heavily online, like you said before, you know, with the heavy social media marketing and whatnot. Now, what are the biggest red flags people and patients should be looking out for?
Okay, I'm just going to say 5 tips.
Yeah, great.
So that it would be nice bullet points for people to understand. One would be choose the surgeon wisely, but not their destination. This is you know, so look at the surgeon's name and not the brand. Look at their deep, long professional history, their long-term accountability. You know, all of these. It's very important. Secondly, check their credentials, not on social media fame. I can buy 100,000 influencer followers.
Yeah,
That
yeah.
means nothing.
No, so true.
Yeah. So look at their verifiable. For example, it's not just going outside. Things can happen. Things can go wrong even here. But at least you've got to be uh, transparent enough to pick up things and agree and discuss all things openly, because this is
Yes.
human body.
Yeah, yeah.
Things can go wrong.
Yeah,
We
yeah,
are
of
there
course.
to help people, right? So it's like
Hmm.
that's something which we've got to place forwards. We are not selling things here. We are going to be discussing what happens on a human body. So verify their credential, like their GMC,
Mm.
or if they are on specialist register here, or on similar things in their other countries. And if they've had formal recognized training, fellowship programs in the past, and what their educational qualifications now are.
Mm.
It's not like what you've done 10, 20 years ago.
Yeah, how
Are
up
you
to date
teaching
are
the
you?
juniors?
Mm.
Are you constantly in meetings, conferences?
Yeah, yeah.
I go to every corner of the world discussing newer tricks to other surgeons,
Mm.
which means that I'd be preparing myself before I go and talk to someone else.
Yeah, too right.
So it's a learning curve. So that's number two. What shall I say? Um,
It doesn't have to be
Ask
five,
them.
it
This is
can
very
be
important. Ask them who's going to look after them if something goes wrong.
okay.
They should ask the doctors or the team that they are who is going to manage their complications,
Hmm.
because a lot of times some of the surgeons from Turkey will call me up saying, "Hey, could you just inject some steroids in my patient's nose?" Uh, and if I say, "Hey, I can't do it in my NHS, you can come outside,"
Yeah.
oh, they are going to say, "Oh, is it for free? Why?"
Yeah,
So if
why?
someone has done the things, then we got to pick up the pieces.
Yeah. Yeah, yeah, yeah.
So
Of
so
course.
who's going to manage your problems, manage your
Aftercare.
complications?
Yeah.
What are the follow-up things which have been discussed with you? Have you discussed your follow-up approaches with them?
Hmm.
And can you contact the team or the surgeons directly, or what if they shut your windows down? It's gone.
Yeah,
After
yeah.
surgery, you've got to think of all of these. And very importantly, joining those points for those examples that I spoke, what's going to happen if I return back home unwell?
Yeah.
So have they got any safety net points? So these are things that you got to see. And fourthly, I'd say be cautious of pressure tactics, the discount things that they're talking about, flash sales, time limited. This is body, this is surgery, this is not, Black Friday sales.
Yeah.
So,
I laugh because I know exactly what you're talking about
yeah.
and I see it everywhere. I see it everywhere. It's frightening.
So that's that. And then
Yeah.
lastly, as I said again earlier, if something is too good to be true,
Mm.
it is probably the case. So, price deals, recovery times, scarless surgeries, risk-free claims, honestly, this is not the way body works.
All the words and not a clue. Now, your second mention was credentials. And
Yeah.
this is something I talk about a lot in my industry as an online health and fitness coach. There are a
Hmm.
lot of unqualified people or people that have learnt via YouTube. Now, we actually had a lady come on before, Dr. Rona. She's absolutely fantastic. She's a dentist in Mayfair, Chelsea area. She's got an amazing clinic, and I saw something via her social media. I don't think it was her posting it, but I think it was someone that she'd spoken about in the past. Now, she mentioned how there are fake people out there pretending they have the qualifications and then selling courses on how to do things. And then
Correct.
those individuals are like, it's like when a bug lays an egg and then it hatches and then they
Mm.
produce more eggs. And it's like there's going to be hundreds and hundreds of unqualified people having been taught by one individual. Like, credentials is huge. And I say this all the time.
Correct.
You cannot risk your health
Yes.
just for a discount. You know?
Look, my friend, if you take any top surgeons in United Kingdom,
Hmm.
look at, going through all the training and whatnot, we spent nearly 15 years
Yeah.
getting
Yeah.
trained. And UK is one of the countries that has got the longest training schedule
Hmm.
for very good reasons.
Yeah. Obviously. Yeah.
Yeah. So it's not, cook someone for 3 years, you're done.
Mm.
Or even
A
as you're
weekend
saying, for some
course.
of these small, cosmetic things like injections and water, learn on a day in some corner in a coffee shop. It's all done. It doesn't work that way.
Yeah, it's scary. It is really, really scary. But again, it's all about money and other people pushing their incentives, isn't it? And pushing their motives. Now, back onto the topic of Brazilian butt lifts and tummy tucks. How dangerous are they?
Well, again, any surgery can be dangerous.
Yeah.
And straightforward, which rounds up all the points, the tips that I mentioned. Because if someone knows their anatomy, their experience, their credentials, things are fine. It's not like every surgery's got, you just have to rule out they being done. If someone knows it, someone discusses openly all the complications with the patients and gives them enough time rather than pressurizing them, and tell look, I always tell my patients when I see them the first time in my clinic, not even on a Zoom, I say, before I even agree to operate on you, I would like to see you once again.
Yeah.
And it's not for anything else. It's the knowledge, it's the trust. And I tell them, look, sometimes in the pressure or in your anxiety, you may forget to ask me questions. Go home.
Yes.
Jot the points down on a piece of paper. Discuss with your family. Discuss with your friends. Come back and talk to me. I will be answering your questions. I will never say, oh, I'm getting upset because you're asking me too many questions. Never.
Yeah.
Ask me all these.
Yeah.
This is very important. And then look at all the things. Discuss the pros. Discuss the cons. Is it really for you? And then take the chance. If not, no, don't go there. Yeah. You're still better off than what you're.
Yeah, and you know what? I really like that because you mentioned something about your fourth point was discounts and sales pressure, right? You're doing the complete opposite because it's like, well, you do what you want to do, but I want to see you again because you're so right with what you say there. I've done it before, and that's why the second you said it, I was like, you've got such a good point. You do leave an appointment and you go, I forgot to ask that. And then you might send an email and the email might not get to the surgeon or the specialist or whatever. Yeah. So the fact that you like doing that, that's actually a really quite a touching thing as well, because you're wanting to make sure these people are comfortable, right? And with the spikes of anxiety and social pressures and this, that, and the other, an individual having a rhinoplasty or something changed with their face, there is going to be anxiety, pressure. They are going to feel a little bit concerned. So the fact that you do that is really, really, really interesting, actually. Right. We are going to only have time for probably one more question. Now, are there any cases that have really, really stuck with you? I know you mentioned complications before, but is there ever a case that you kind of feel like, wow, like the fact that we could bring that back from where it was really stood out on you?
Yeah. Again, because I work mainly on the face, I can talk about one of the nose job cases where this person was operated 4 to 5 times elsewhere. And I jumped into the case on the 5th occasion. So which meant, I had to also dig in deep into their psychology as well, whether, so this is quite interesting because it's not just the nose itself. It's also someone who is psychologically, I wouldn't say driven, but ill-driven. Or if someone's got body dysmorphic disorder, BDD.
Yes.
And that's not been picked up before. And so they're on that constant downward spiral of getting more surgeries without people picking up their psychological aspect and only looking at their facial or skeletal aspect.
Well, yeah, that's it, really, isn't it? There's so much more to it than just the physical, right? And that's a big thing at the moment: physical, mental well-being, and so many people are talking so much more about the mental well-being. So I get
that. I had to tie up all of these before I could gain their confidence, get their realistic expectations.
Yeah.
Without that, you do that, they're going to go to the 6th surgery. So that's not, and you've got to also, they're not wrong, but they've not been looked after well. That is the key. You've got to feel the empathy and help them out psychologically as well. Talk to them like a psychologist or get a really professional psychologist involved. You've got to tie up all of these. It's a 360 degrees approach, not a singular path.
Yeah, no, I get that. Right, Dr. Anil Joshi, sorry.
Actually, yeah.
Thank you so much for a fantastic conversation. I know we spoke about social media, but do you have any socials that you want to maybe mention now? Do you have a website? Is there anything, if someone was interested in working with yourself, where can they find you?
Yeah, so I do have my Instagram. I don't sell things, by the way.
Good man.
It would be completely paradoxical doing that, but I do have my social media handle. It's called as I am Anil Joshi, my full name, but I am AM.
Yeah.
And through that, you'll also be linked to my secretaries into the websites, and they've got the contact details there. And you can also see that I'm not selling any products. In fact, you'll see a lot of my talks in various parts of the world, giving lectures, discussing with fellowship programs, education, and of course, some of the cases well designed, which are all after consents. And that is all. So you take it in a very professional way. So,
Amazing.
That's it.
Well, you've been a star. Thank you so much for your time. And we'll speak to you soon.
Pleasure.
Take care.
Look after yourself. Bye.
Fubar Radio.